Many patients suffer from overactive bladder symptoms for years before seeking treatment or finding the right solution to meet their respective needs.
The main symptoms that I had were leakage throughout the day and also throughout the night. And it started just a little bit of leakage so that I could make up my own pads and it would help. But after a while, it got to be more and more and more. It would be leakage all during the day, as well as pretty much all during the night. And what would happen during the night was that I'd be sleeping fine, but then when I woke up, all of a sudden I had to go very, very fast to the bathroom. And where I live right now, the bathroom's kind of far away. So I many times did not make it. And I knew that I needed some kind of help other than what I was providing for myself.
I was seeing another urologist for about 19 years for bladder urgency, and his motto was, well, his theory was that I wasn't emptying my bladder properly because I needed to be dilated, and he would dilate me twice a year, and I would go home and I would be what I thought was fine, but I would still go to the bathroom all the time. I would actually go just about every hour, hour and a half, and sometimes more than that in an hour. The first time I came here, I remember sitting in the office and going to the bathroom 15 minutes after I got here, and then going again 45 minutes later, all within, I think, an hour or so. So I was going a good number of times. I couldn't go anywhere without knowing where there was a bathroom, and I always had to go to the bathroom before I left the house. If I was going on any kind of trip or even to the mall. I felt I was so desperate. I was actually at the point where I wasn't sleeping through the night, and I hadn't been for years. I was getting up every hour to 2 hours to go to the bathroom, so I was not sleeping. I asked my gynecologist if she could please recommend somebody. She told me about Dr. Siegel, and I came here.
For these women suffering from overactive bladder symptoms of urinary urgency, urinary frequency, and urge incontinence, their successful OAB treatment started when they were referred to Dr. Judy Siegel, a urologist with a practice outside New York City.
Okay, so when patients come to me with urinary urgency frequency, what we call overactive bladder now, they've usually tried most of the medications on the market for overactive bladder, the anticholinergic medications. So they've come to me for a non-medication-based option. Some patients come to me specifically because they don't want to take medication for the rest of their lives. And they've made that decision.
When I first came to Dr. Siegel's office, I had called her up and I wanted to make an appointment, and I said I need a dilation done, and her response was, "We don't do that here." And I came in anyway, and she examined me, and I explained what my history was, and she knew exactly what it was.
So then I started to go to a urologist in my general area and ended up taking some medications, but my problem still was not improving enough to be able to make my lifestyle and my problem coordinate. As a result, what I did was I then looked around for someone else who might be able to give me more relief from the problem. And it was then that someone I knew recommended Dr. Siegel. So I then came to Dr. Siegel, and after testing, she then came up with two treatment possibilities. The first treatment was wearing the patch, which did help, but still was not enough to give me the relief I needed. I found that especially the nighttime was a big problem for me. During the day, I was aware I needed to go. During the night, I wasn't aware if I was sleeping. So I needed something in addition that would give me the possibility to be able to not have accidents. And it was at that time that Dr. Siegel suggested a needle therapy that would help stimulate, I think, the nerves in my leg to be able to tell my bladder to work better. And that one was very appealing to me because I didn't have to wear anything, and I didn't particularly care to have something implanted. So the needle therapy was much more appealing, and we started it and has been successful.
While Dr. Siegel has found that most patients are comfortable with the type of therapy and method of delivery, there are some patients who admit to having reservations.
When Dr. Siegel first told me about this procedure, I got a little nervous because I'm needle phobic. I can't look at needles. I have a hard time with blood tests. I do them, but I really struggle. And I was very frightened. After the first time, I was a little lightheaded. After the second time, the needle needed repositioning, and I got a little nervous as well. But after that, it was so beneficial that even needing the repositioning, I could bear it.
For most patients, the response to the therapy is very gradual. It is important for the patient to commit to the full series of 12 treatments before evaluating an individual patient's response.
It took a while in the beginning for for me to know what I was supposed to be feeling. I saw a change in my symptoms very gradually. By the time I got like 1/3 through, there was a little change. By the time we got to the 10 times or the end of the treatment, there was a significant change to the effect that sometimes I would sleep the whole night and not have to get up and go to the bathroom, and no accidents.
Patients who respond to this therapy often describe their response as having a dramatic impact on their life. These patients' reports are supported by recent clinical publications which describe the significant and quantifiable correlation between improved quality of life and urgent PC therapy.
Prior to my introduction to this particular therapy, I needed to carry pads with me so that I would not have accidents. I needed to have a bathroom available to me pretty much on a 2 to 3 hour basis, and sometimes even more frequent. With this particular therapy, I pretty much forget that I have to even carry pads with me, though I do if I'm traveling, especially on a plane. But my lifestyle is pretty regular. As time went on, I began to be able to take up a quite regular lifestyle and not have to depend on having a bathroom close by, so that I was able to live a normal lifestyle and not have to worry that I was going to have an accident.
The benefits have been incredible. I mean, I'm now sleeping 5 to 6 hours a night, which I haven't done in years. PTNS has made a tremendous difference on my life. I couldn't even finish running my errands during the day. It reminds me of yesterday when I was with my 2 daughters and I said, "Does anybody have to go to the bathroom?" And they looked at me and they said, "No, but I know you do." And I said, "No, actually, I don't." It's really changed my life. I still, out of habit, look for the bathrooms and where they are, but I know I don't need them. I sleep through the night, which has been the biggest difference. I mean, I'm more refreshed during the day. You know, I'm a different person. Try going without sleep for 3 years. It's not fun. And I'm certainly not one to lay low. I'm up and out and doing. So it's been great. It's made such a difference.
Yeah, when you have success with PTNS, it's really gratifying and often very dramatic. I often can't predict who's going to have the maximum benefit from PTNS. But the way I look at this therapy is there's really no downside to it. If a patient's motivated, if a patient wants to try a non-pharmacologic option for their overactive bladder, if they're willing to invest the time and the commitment, I think it's worth a try.
First benefit is helping our patients. When we hear back from a patient that they've slept through the night for the first time, we're all jumping up and down around here. When we find that a patient is not wearing a mini pad for the first time in 10 years, we're all excited.
Many individuals who have been helped by therapy with the urgent PC consistently state, more people need to know about this treatment.
For people who have my particular kind of problem of bladder control, I would like to encourage individuals to consider the possibility of a needle therapy, because it gives you a chance to see how it works for you. And if you can have the relief that I have had and be able to live a more active, a more, well, basically a less worrying time, so you can be free to do what you want to do when you want to do it, and you don't have to tie yourself down to other kinds of treatments perhaps, or lack of treatment, so that you can go back to your regular lifestyle.
The treatment is so worth it. It has changed my life. It really has. It's much richer. The recommendations I would have for others if they were suffering the way I did, from urgency, frequency, and whatever else, is that they certainly give it a shot. I don't think enough people know about it. I don't think it's been publicized enough. I tell people about it and they're shocked. They've never heard of this. It's unusual, and yet they see the results because I'm not running to the bathroom constantly. I just think that people out there should know that it can certainly change the quality of your life. I look forward to these because they've really helped me so much.
My greatest source of self-referred patients are existing patients. And a happy patient seems to just spread the word to her girlfriends.
Treatment with urgent PC is a clinically effective, minimally invasive therapy for treating individuals who suffer from urinary urgency, urinary frequency, and urge incontinence. The stories shared are specific to these individuals. While clinical publications suggest that the majority of patients respond to treatment, individual results will vary. Uroplasty thanks Dr. Judy Siegel, her staff, and her patients for sharing their experiences with urgent PC therapy.